Next. Next.
Yes, ma'am.
Okay, let me introduce for those who are not there or who are new, that I have 45 years of professional experience in a variety of settings such as teaching, clinical administration and management, have published extensively in referred journals and authored a book of historical perspectives of nursing and Indian nursing leaders from 1947 to 2024. The third edition is in print. Have been TNAI branch president for 10 years for USA and Canada. Also was a national representative of TNAI at the United Nations for NGO conferences. Patron of 4 prestigious nurses societies in India. One is Clinical Nursing Research Society, Nursing Honor Society, Nursing Teachers Association of India, and our, of course, beloved NSS Society. Worked as Director of Nursing in Gwalior Sophia Nursing College, GNC Nursing College, and in Jaipur Mahatma Gandhi University. Work now as freelance consultant of curriculum development for nursing colleges. I will be just giving brief message. Just go to message, please.
Yes.
Respected dignitaries, chief guest, guests of honor, NSS President, NSS National Executive Team, and presenters, lovely audience, lovely students. Greetings from New York, USA. Namaskar. We are here once again with our research presenters who will be enlightening us with their findings and their nursing implications. We are blessed to have our NSS family, especially students who are privileged to hear and soak all the wisdom from our nursing stalwarts. My best wishes and God's blessings for another successful webinar session. As MC now, I will start introducing our respected dignitaries. Next, please. Okay, and the first is our founding president, National President, NSS, Professor Dr. Binu Jo. He is a gold medalist in MSc and is currently working as principal. He has 16 plus years of professional experience and is active in enhancing our NSS mission. He has conducted many national and international workshops and conferences and is a proponent in our successful recent international conference in Congress or collaboration with Vibrant College of Nursing in Surat, and also on 25th and 26th, just 2 days ago, or 1 day ago, according to me, today is my 27th April night, that very huge success in a national conference in Junagadh. I think he needs clapping that he has worked very hard for that, and of course, along with other executives. He has published many research articles in referred journals and has authored a textbook on pediatric nursing. Sir is lifetime member in many prestigious professional societies and on the boards of referred nursing journals. He is pillar of our NSS society, and I would like to invite Binu sir to give his valuable message. On to you, sir, if you are there. Otherwise, I can continue. We will come back to him. Go to next.
Yes, ma'am.
Okay, just quickly to say that we are doing it at national level, and this is number 6 webinar. Our chief guest is Dr. Amandeep Bajwaji. I will come to her profile later. And organizing committee is, of course, me and Binu sir, Alkaji, Muttu sir, Anu Joykuti ma'am, and Kuntla Sahaji. That is another pillar out of those 4. She makes our certificates and those cards, membership cards, brochures, and is very valuable member of NSS family. Guest of honor, Professor Dr. Vimla Kapoorji. Of course, she is having fever and cannot join us. Then Bimla Devi Kaushalji, another guest of honor, and she is MSc Pediatric Nursing lecturer, and I will come to her profile later. Next slide. Okay, we have one of the really spicy thing going in induction ceremony, and the oath will be conducted by our president. And then we have 3 presenters today, very stalwarts and nursing, very seasoned people who will be sharing their findings and implications in our nursing care. It can be very valuable. Next slide. Okay, next slide, please. Coming to our chief guest profile, Madam Dr. Amandeep Bajwaji is currently working as head of department and professor of psychiatric nursing in College of Nursing in Amritsar. She has many years of experience in a variety of professional settings. Madam has participated, presented, and organized many workshops and conferences. She had been a resource person, board member of many referee journals, and has published extensively. She is chapter president of Disha number 11 of Punjab. I invite our chief guest to give message and blessings to the presenters. On to you, Madam Bajwaji. I saw her, she's on. Call Muttu sir. Dr. Bajwa.
Good morning, ma'am. Good morning, ma'am.
Good morning and good to see you. Okay, with your message. Just say your message, please.
Good morning to everyone. So very warm greeting to all. So it is my honor and immense pleasure to be part of this esteemed society. So I would like to congratulate to all the national governing body member and chapter presidents who are striving hard for the growth of society and spreading it to every corner of nation. So extend my warm thanks to the Chief Patron Dr. Shiv Khanna and National President Dr. Binu Jo for creating an excellent platform for the nursing professional to present their research study. So enhance their scholarly skills in writing, speaking, leadership in community services through nursing society. So I also extend my gratitude giving me an opportunity as a chief guest. So thank you, ma'am.
Nice. Just check if Binu sir is there.
Yes, ma'am. Good morning.
Not yet? Okay, let me read about Bimla ji, then we can go back again. Our guest of honor, senior advisor, National NSS, respected Iron Lady, Madam Dr. Bimla Kapoorji is our senior national advisor of NSS. In addition, she's also gracing senior nursing advisor role in CNRS. She has 55 years of professional experience in a variety of professional settings. She's pioneer in distance in nursing and national and international, and has been chairperson and expert in national nursing bill commissioned with the Ministry of H&FW, Government of India. The bill is now become a law. Madam has published extensively and authored her very first psychiatric book, which is a psychology for nurses, and still held as a key book for the students to use the skills for rendering quality care to the patients. I cannot invite Madam as she's down with fever, but we are missing her and her wishes are always with us. So go back and see, keep on seeing if Sir is back, otherwise go to next. Okay. Our next guest of honor is also a resource person, Professor Mrs. Bimla Devi Kaushalji. Madam has 37 plus years of professional experience in a variety of settings and has published extensively, or rather going into that direction with an article and did 2 presentations. She was awarded as frontline corona worker in COVID-19 pandemic period. Madam is waiting to present her viva for her doctoral degree. Best wishes for brilliant success in that. I invite you, give blessings to the research presenters and also to be their resource person. On to you, Madam Bimla Kaushalji.
Good morning, ma'am, and good morning to all my
Good
respected
morning.
colleagues and members. How are you, ma'am? It's my pleasure to join this NSS group, and it's really very, very valuable and important for me. And I feel very happy to join you, ma'am, particularly to see you. And very good morning to all of the members and my respected members. And I wish you all of presenters, wish you to best of luck and wish you for your great achievements and further participation in this NSS group. Thank you, ma'am. Thank you. Thank you to all respected Binu sir
Wonderful.
and all others, respected ma'am, Amandeep ma'am, Binu sir, and particularly you, ma'am. You provide me the opportunity to join you. Thank you very much, ma'am.
You deserve it. Thank you. Thank you, Bimlaji. Good to see you, your smiling face. And next. Okay, did you check if Binu sir is there? Not yet. Okay, maybe problem because he was traveling also for on his vacation and we just asked him to be with us. Now for Muthu sir, what can I say? He is my right hand. Sir is president of our NSS for Sahitya chapter number 15 of Karnataka. In addition to doctoral degree, he has MBA also in hospital administration. He worked as NAB consultant and as clinical auditor, and he has certified 10 hospitals for NAB at national level. He has received many certificates and awards. He is in training of trainers, taught course in midwifery, faculty development program from NRC SSC, New Delhi. He is a certified internal assessor for Kayakalp, NQAS, MUS, QAN, LAQSHA, Lakshya program. He is also certified Lean Six Sigma, Green Belt, Yellow Belt, and Black Belt. Sir is life member of many nursing associations and societies such as TNAI, QCI, NTAI, NSS, etc. He is a certified master trainer for simulation-based education from NRSC New Delhi. He is organized and he has organized national and international webinars. I invite Dr. Muthu sir to continue second part of MC. On to you, sir. But first check with Binu sir if he's there. Otherwise, continue. Unmute.
Thank you for the introduction, ma'am. Thank you so much.
Okay.
Just I have texted to Binu sir also, ma'am. I think he's not reverted me back. I think sir might be in the traveling.
Okay, must be problem. Yeah.
Yeah, ma'am.
You
Respected
continue.
Khanna, ma'am. Patton of NSS, and Dr. Binu sir, President of NSS, and Professor Bimla Kapoor ma'am, National Advisor, and today's chief guest, Dr. Amandeep Bajwa ma'am, Professor of HOD and Psychiatry Department, and the guest of honor, Professor Bimla Devi Kaushalaji ma'am, and the eminent speakers of today's event, and NSS members and all the participants. It's my honor and pleasure to be here as a guest of honor and master of ceremony in this research presentation
Wonderful.
series. Nursing research has a tremendous influence on current and future professional nursing practice, thus rendering it is an essential component of educational process. This research presentation series are providing opportunity to the students, clinical nursing personnel, and faculty members and the budding nurses to gain knowledge from their nursing leaders and disseminating and utilize their research findings in the different areas. I would like to thank Dr. Khanna ma'am for initiating and providing this platform for all our nursing personnel to disseminate their
Thank
PhD
you.
work with others. I wish to all our today's research presenters that your productive work will be utilized by the individual and the society. Now I would like to introduce our first presenter, Professor Dr. Dinesh Rai sir. Dinesh sir has a doctorate in nursing and 5 years of experience of professional experience in variety of settings. Currently, sir is working as an associate professor in College of Nursing in Madhya Pradesh. And sir has a project was published in a scientific newspaper. And sir is organized many nursing competition in his college for students and had been examiner for various nursing papers. And he's fully motivated educator with a contagious smile. And I invite Dinesh sir to present his presentation. Sir, over to you, sir.
Dinesh,
Dinesh sir.
sometimes the internet problems also. Give him one
Not there,
minute.
ma'am. He is
Yeah,
not
he's
there.
there.
Dinesh sir is not
Oh,
there.
sir is back.
Sir is there.
First, let him
Dinesh sir.
let him bless us.
No problem.
Yes.
Let us continue, madam.
Give him before he
Yes,
starts.
ma'am.
Dinesh starts.
Dinesh sir is not there, ma'am.
Okay, we will go to next, but give him first. Yes,
Ma'am,
sir.
now I would like to call Dr. Binu sir to give his message. Over to you, sir.
Ask them to mute.
Binu sir, over to you, sir.
Yes. Respected dignitaries, a warm greetings to one and all the presenters and dear audience, a warm greetings of the day and namaste one and all. Yes, research plays a very vital role in the advancement of healthcare and also in improving the lives of the mankind and strives to provide the best quality care. Research is truly and will enhance our standards. It helps us providing the deep insights and the facts with the proper scientific evidence. And as our nursing scholars society's main vision is also to promote scholarly activities in all the spheres of the nursing profession. Yes, it's really a great moment when our own founders of the society share their knowledge of research among the fellow professionals. And in continuation with our research series, I'm really excited to be part of this webinar series of research. I take this opportunity to thank all the executive members for the great success of the uh, national conference in Junagadh. It was really wonderful. We had around 800 delegates who had a tremendous experience in joining in Junagadh. Thank you all and all. Thank you.
Thank you, sir. Thank you for your blessing, sir.
Check with the Dinesh sir. If he's not there, we will continue.
Dinesh sir, are you there, sir?
He's not there, sir.
Okay, sir. Shall I go with the other next presenter, sir? Ma'am?
Yeah, and I will write to him what is happening. Yeah, go
Yes,
to
ma'am.
other.
Yes, ma'am. Now I would like to introduce our second research presenter, Dr. Jyoti K. Ma'am. Madam is certified palliative care and postgraduate CVTS diploma in naturopathy and yoga. And Madam is a trainer for simulation-based education in COVID-19, mental health, and Omicron in addition to her doctorate in nursing. Madam is the president of our NSS Saffron Chapter 10 of Chandigarh. And Madam is awarded Nursing Ratna Award 2023 by NTI and the Commendation Award for the Best Services in COVID-19 pandemic time. And Madam is an active researcher and Best Paper awardee and more. Madam received first prize in ECG interpretation and wound care in addition to the appreciation certificates in medical relief education camp, Punjab DEO Education Innovation, and from National Institute of Disaster Management. Currently involved in an e-learning program of organizing national and international CNEs. Now I would like to call Dr. Jyoti ma'am. Over to you, ma'am.
Thank you so much, sir. Good morning to everyone. Good evening
Good
to Dr.
morning.
Khanna. How are you, ma'am?
Great, and you look very nice and all ready to present.
Yeah,
Good luck.
thank you so much, ma'am. Please allow me to share my screen.
Yes, ma'am. Yes, ma'am. Ma'am, you can just see, ma'am. You can.
I hope my screen is visible.
Yes, ma'am. It's visible now.
Very clear.
Coming to the directly about the background of the study, disease of the heart and blood vessels are increasing
A little
rapidly.
louder. It's hard.
Out of 5, 4 deaths are due
Yeah.
to cardiovascular diseases, and these cases have been increasing fourfold. Since 2019, we got to know that it has doubled, and CVD deaths have been increasing day by day, and right now it is 18.6 million. And ECG is an important diagnostics tool through which we can directly come to know the complex dysrhythmias without any invasive procedure. And if we are able to interpret it carefully, we can directly reduce the burden on the patient's pocket, and wasted investigations and mismanagement of client can be prevented. Literature shows that ECG can be predicted, and this prediction of risk factor for CVD can bring enlightenment to medical field and nursing field, and we can promote patients and everyone to how to prevent this CVD. ECG remains an inseparable tool, and prediction also will help early identification. And for this, definitely nurses need to master the skill of ECG interpretation. Majority of nurses are unable to recognize even the normal sinus rhythm, and studies have shown that they could not recognize rhythm, so they need training and education. Goodrich and Sherman did different studies, and they said that identifying the changes in cardiac status and monitoring the patient's response will be only effective if nurses are able to identify the ECG rhythm deviation. And long-standing gap between the knowledge and practice is evident, and this gap can only be reduced with the help of training the nurses. And it is not only the training the nurses, it is also training the students as well. Nurse educators today, if we say, they are producing very proficient and excellent students who can perform very beautifully on paper. But when they go to a clinical practice, they are not that skillful, they are not that competent. So because the teaching is an ideal situation, what we are teaching, but the circumstantial changes and the processing of thought should change according to the circumstance. That is lacking. And literature strongly advocate that nurses who are spending the maximum time with the patient need to have this knowledge and skill. And nurses also play an important role in different aspects of patient care. So definitely nurses need to have sufficient knowledge about interpretation of ECG. According to Indian Nursing Council, teaching and learning should be proactive and transformational. And if it is transformational, then only they will be able to adapt their thought process according to the circumstances and the disease condition of the patient. And the same thing is used in ECG also. We learn about basic arrhythmias and then we shape that to complex scenarios. Therefore, the amalgamation of transformative learning and decision making lead to better clinical judgment process. Government of India has also been promoting blended learning. Blended learning, when we say, it is both online, offline, and using of different teaching technologies. So nursing education also needs such amalgamation. And WHO says that nurses training have to be problem solving and clinical judgment need to be involved in that. And that is only possible through clinical posting. Please excuse my bad throat. In my personal experience, I found that during clinical posting, the students who are posted in first month will not have same exposure as of second month posting. So the change of the patients and the change of disease condition is exposure is not same for every student. And due to the limited hours of clinical posting, they are always hurried to meet their academic requirement. So they need to dig into the pathological condition and understand the ECG and learn through that, instead of only focusing about the academic requirements. And another observation, nurses are only merely following what physician has written in the case. In the case file, they need to learn, enhance their virtue, and they need to look into it, how and what is happening. So today nurses need to perform more than just following the orders. So nurses are anticipated today to make their own judgment regarding their medical treatment, pinpointing the deviation, and that's how they are able to give better and quality care. So the title of my study is to assess the efficacy of virtual learning program in terms of acquisition and retention of ECG interpretation and clinical judgment among the nursing students of 3 different states in North India. Objective was to develop and validate the virtual learning program, compare the acquisition and retention plus the clinical judgment before and after virtual learning program. Also to find out the relation between the acquisition, retention, and the clinical judgment. Thereafter, the association was also found between the selected variables, acquisition and retention, and clinical judgment. Lastly, the acceptability of virtual learning program was also assessed. I feel hypothesis we will be discussing when we are talking about the results and discussion. All the hypotheses were tested as 0.05 level. Operational definition, the virtual learning program is to bring a change in acquiring and retaining the ECG interpretation skill and clinical judgment score among the nursing students. Virtual learning program was online computer-aided teaching intervention to deliver ECG educational content and to assist the develop ability to differentiate ECG waveforms, and followed by the same knowledge in reaching to clinical judgment while caring for the patients. We had 5 modules. That was first was review of anatomy, second was related to basic ECG rhythms, and thereafter it was about systematic interpretation, and last was different dysrhythmias. Coming to ECG interpretation, it is a skill that includes assessment of ECG waveform intervals, segments of ECG, and identify different abnormalities. Acquisition and retention of ECG interpretation refer to the gain in knowledge, comprehension of the content, recall of it, recollect, synthesize the knowledge, and then come to a conclusion. In present study, it was assessed with the help of 4 parallel forms. Clinical judgment was referred as the process of utilizing the knowledge and skill over time to overcome the patient-specific problem. And it was assessed with the help of case-based scenarios. And nursing students, we all know those who were enrolled in BSc Nursing second year. Coming to the conceptual framework was used of Stuffle Beam concept and CIPP model, that is context, input, process, and product model. In this, we utilize, starting with the context model, need for the assessment of the knowledge and clinical judgment process, and for the virtual learning program. Thereafter, 4 parallel forms were developed for ECG interpretation, retention, and clinical judgment. In process evaluation, final study was done. Final study data collection, assessing of pre and post knowledge acquisition, retention, and clinical judgment was done. Here we also look for the relations and association of different variables. Lastly was product evaluation, where we looked for the virtual learning program, which was already developed and tested, and how it could be utilized, and the acceptability of virtual learning program. And further feedback was not part of the study. Therefore, we did not go for assessing the recycling decisions. Review of literature, I would cut down because we have shortage of time, though it was divided into 3 parts only. ECG related to literature. Then it was also related to virtual learning program, how they can be developed, how it is going to be influential, then related to the implementation and evaluation of learning program. Coming to the methodology, research methodology which was used was quantitative experimental approach. Research design which was used was quasi-experimental design, pre-test, post-test comparison group. This is a schematic representation of the research design. Day one pre-test was done for both the groups where selected variables were assessed and acquisition was also assessed. Pre-test was done. Then in control group, conventional teaching was done, whereas in experimental group, virtual learning program was implemented, and day 7 post-test 1 was taken, day 15 post-test 2, and day 30 post-test 3 was and on post-test 3, in experimental group, acceptability was also assessed related to virtual learning. Coming to the variables, variables are the attributes that samples have. And in my study, independent variable was virtual learning program, and dependent variable was acquisition, retention, and clinical judgment. Extraneous variables were also looked into it, like age, gender, previous year examination marks, parents' occupation, and if in case they have done any course out of their interest. Setting of the study, we selected 3 states, and these 3 states were selected who had a parent hospital, tertiary care parent hospital, and we chose 176 nursing colleges from Haryana, Punjab, and Himachal from Indian Nursing Council list. And out of these 176, only 2 nursing institutes from Haryana, 8 from Punjab, and 4 from Himachal allowed us to conduct the study. Sorry, 2 from Haryana, 3 from Punjab, and 3 from Himachal allowed us to do this study. So total 8 colleges. These were the 8 colleges where data collection was conducted. Allocation of the nursing institutes in experimental group and control group was based on convenience, whereas the selection of the states was with the simple random technique. States were used. Population used in this study was BSc Nursing second year students, as the topic is in their curriculum. Sample calculation was done based on the total population, which was identified to be 20,375. And with the formula, we came to the conclusion that 378 should be the sample size. However, based on the attrition rate, we wanted to look for the mortality of the sample also. So it was also counted, and the actual sample size came up to 473. Sampling technique which was used was multi-stage sampling, as we chose colleges with simple random, nursing institute with purposive, allocation was convenience, and selection of sample from the nursing institute, selected one was total enumeration sample. So this is why we use multi-stage sampling. Inclusion criteria, as I've said, who were willing and BSc second year students. And in exclusion criteria, we thought that who were absent and who did not complete the virtual learning program would be not included in this study. Sample mortality was also looked into it, as I said, who were absent, who did not complete. So therefore, at the last, we had 489 nursing students who were enrolled in this study. This is the contour diagram where we can see the mortality of the sample. If you look at this one, day 1 to 6, we had around all the students, but there was absenteeism also. So coming to the last day, final data collection was conducted on 189 in the control group and 189 on the experimental group. Data collection tool and devices, when we talk about, we had the student nursing profile, and we also had ART, which is acquisition retentions tool with 4 parallel forms, and clinical judgment also was 4 parallel forms. Opinionaire was also there for assessing acceptability. Coming to the student nursing's profile, we had age, gender, percentage of previous year, clinical posting done at cardiac unit or no, parents' occupation, prior knowledge to ECG or any online course done. And also we had a learning style preference assessment as well. Learning style preference was assessed with the help of Honey and Mumford Learning Style Inventory. It had 40 items, and it was used as it is because it is an open university which provided us with the tool. This is the blueprint of learning style preference, where we had 4 styles of learning among the students. Development of acquisition retention tool, it was used with the help of review of literature and the different internet searches and extensive consultation with the guide. Item had different tool had different items, that the 35 multiple choice questions, and equal representation was done from different modules. All 5 modules were conducted. This is the blueprint of all 5 modules which were represented here. So this is about the acquisition retention tool. Coming to the clinical judgment tool. Clinical judgment tool was a little different. We had case-based scenarios created. Online, we created small animated videos where patient would be seen, and different clinical scenarios were created, and ECGs were displayed to perform decision making. And the student had to notice what is there happening in the scenario. Then they would interpret, give the reasoning according to the question which has been asked in the further sequence. And each clinical scenario had 3 to 4 questions. This is the blueprint of the clinical judgment tool. You can see here we have looked for noticing, discriminating, reasoning, responding, and reflection of the knowledge gained during ECG interpretation. Coming to the acceptability, in acceptability, we had 15 items, and it was based on objectives and instructions given for the VLP, module content, visual appeal, visual methods, evaluation methods, and overall appraisal. So this is all about the different tools which were used. Coming to the development of virtual learning program. Virtual learning program, the first manuscript was based on my Bloom's taxonomy, coming to the simple to complex and specific to journal. And it was prepared with the review of literature, and then it to content validity and was also assessed, and validation was also done by the experts. For all the tools, content validity and validation was done. Also, the tryout was also performed, and reliability were also assessed. The actual the specific feature of the virtual learning program was video teachings and whiteboard animation. And each module had objectives followed by video teaching and summarization. And professional developer was approached to develop the prototype of virtual learning program, which was uploaded. And again, it was assessed by the validators, and they use it just like the students or the sample would use. Suggestion and comments were incorporated, and these were the final tool, final intervention, which was having 5 modules. The salient features were that whiteboard animation, as I mentioned, and videos were also recorded. The another thing was that during the lecture, ECGs were showed, and student can zoom in and look at the different waveforms. Each individual had their own login ID. As a researcher or investigator, I did not have any access to their learning platform. Attrition was limited by that. Incomplete information was not accepted unless and until they complete the test, then only they were allowed to go to the next module. It was unidirectional, and the learner could not skip or record any teaching, because during pilot study, we found that students are taking the screenshots of the test and then they are looking for the answers, and they could not drag it to the fasting or slowing the learning. Each module had a target of 85% score. Once they attain the 85% score, then only they can move to the next part. Attempts were not limited. They can read as many times as they wanted. Incomplete responses were not allowed. Even the last thing was, after the module test, they could review what they have done, and only correct options were given as a review, not the wrong one. For wrong one, they were directed that you go to this part of that teaching area and you learn. And on successful, there was a message which was displayed that congratulations, you have completed the module. Even the chat facility was also available, and so during the data collection, only 1 query came up. And after learning all modules, they had 2 post-tests, 3 post-tests to be done, day 7, day 15, and day 30. Problems encountered were, as I mentioned, the whiteboard COVID situation came in when we started with the developing. So that was the reason we overcame with the whiteboard animation and animated videos. And students were capturing screenshots, that was also reduced. And another thing that students were using two devices, like one was laptop and other was mobile phone. So they were referring simultaneously. So that was also reduced after the pilot study. Implementation, I've already discussed that a pre-test was done on day 1 and 1 to 6, they were doing virtual learning program. Day 7, day 15 and day 30, they were having post-test. For experimental, because I could not reach to all the different areas, so we took help of enumerators. 8 nursing faculties were identified in different areas. They were only having duty of asking the students to complete the test. Learning was self-paced, it was unidirectional, and only enumerators were saying they were contacted telephonically. They would ask students to complete the test, and that was the only thing that they had to do. Ethical permission was gained from Maharishi Markandeeshwar University and also from different colleges which were selected. Informed consent was taken in written from the students who were participants. Anonymity and confidentiality was maintained. I think this part I have already discussed that we have done the data collection from January 2022 to February 2022. And no training was given to the teachers who were helping me to do the data collection. Coming to the results and discussion, these were the hypotheses which were used. Hypothesis 1 was that there will be no significant difference between mean pre-test and post-test score of acquisition and retention and clinical judgment score. And there will be no significant difference between the area-wise scores. I request Meena madam to please mute their mic.
Yes, ma'am. Meena ma'am, please mute.
Yeah, sure. Good morning to everyone. Yeah.
Coming to the hypothesis 3, there will be no significant difference between the post-test of clinical judgment, and hypothesis 4 was there will be no significant difference between the clinical judgment of area-wise score. Hypothesis 5 was related to no significant difference between correlation between acquisition, retention, and clinical judgment. Hypothesis 6 was related to the selected variables association with these two areas of interpretation and clinical judgment. Coming to the main results, these are the results which were related to student nurses profile, only the gender, because female nursing still is a female based, female dominant profession. So that was the reason we had male differentiation. Similar findings were also found in different review of literature, where Habib Zada reported that mean age was 23 years, and in the study conducted, it was for the interns. Literature does not reveal supporting the literature stating that parents' occupation would influence on learning of nursing students. As we also look for the parents' occupation, and we found that there was no significant results. Coming to the learning style preference, the chi-square was computed and there was no significant values were found on calculation. Felden and Brent also reported that learning style never reflects the suitability of students for any topic. However, it only helps in deciding the approach adopted to learn. So their style does not influence the learning, but how they are going to learn, that only will be used. So this was concluded that data was in congruence with the other studies and previous studies which are already done, and nursing profile were considered to assess their influence of data collection. Section 2 was related to acquisition and retention of interpretation scope and before and after. Looking onto the comparison of acquisition retention, we can see when it was done in the experimental and in the comparison group, there were no significant correlations between significant values which were there in comparison group. It was only in experimental group. We can see between day 1 and day 7, it was 40.52 T values were conducted. So this way, it can say that there was a significant difference in experimental group after learning from virtual learning program. And This is what I said just now. Coming to the discussion, Habibzada also conducted a similar study on interns, and they also said that during the learning from online platform, the experimental group had better learning, and the mean score were different in both trainings, and it was found to be successful to bring positive change in learning ECG and dysrhythmia. A. Prabha also conducted a study on nursing students and implemented a virtual learning program on ECG interpretation for 6 days. And she also found that virtual learning program improved the mean test scores. Coming to the comparison on overall comparison between the groups. Previous one, it was in the group, but in the experimental and comparison. Now it is between the groups. When we look at the between the groups, we can see all 3 days there were significant values which were calculated. They suggested that virtual learning program had improved the acquisition and retention of ECG interpretation in experimental group, and retention was maintained. If we look at the day 15 and day 30, so it clearly reflects that the retention was there in the group. Therefore, hypothesis Z01 was rejected. Review of literature also shows that learning new concept in psychologically safe environment and enhances knowledge with its retention for longer period of time. Because when we learn from online platform, we find ourselves psychologically safe. There is no stress of teacher. There is no stress of environmental factors. So that is why students are more free to learn. This is not only in the self-made test, it is also for the standardized test, and like NCLEX RN. Study was done, and they found that even for the NCLEX RN test teaching, they used online platform and they performed very well. And Berkeley KM also says that better capability and independence with e-learning can be identified. Area-wise assessment also shows that experimental group in all areas, it was found to be very significant values, but in the comparison group, if we look at basics of ECG and dysrhythmia interpretation was the area where they also found that it is a significant difference. So this shows that it is not only the online learning, even the conventional teaching also brings the changes. So 12, Joseph R reported that 12 model what they had used, and ECG conceptual teaching brought a significant difference when the online learning course was used. Practicing ECG was also part of their program, and weekly interaction was done. So their results showed that there was an increase in self-confidence of the participants. And Berkeley also suggested that traditional lecture method is also reliable way of teaching, but retention is little difficult in that part. Coming to the assessment of it was assessed that each day between day 1, day 2, day 7, day 15, we assessed with the help of T-formula. But we wanted to assess whether overall it was bringing any change or no. For that, we assessed ANOVA, we used ANOVA, and we found significant values in both the groups. Conventional teaching also brought changes, and online teaching also. But when we look at the difference between two values, it is way higher. So the conclusion was drawn that conventional teaching program definitely brings changes, but online teaching brings better changes. So we wanted to see where it has brought changes. So for that, we went into the linear regression, and we looked into journal linear model, and post-hoc Bonferroni scores were identified. So if we look at these, we can identify the day 1 to day 7, there were changes and retention was maintained. So because of time constraint, I'm just skipping few slides. This evidently shows that virtual learning program was effective, and the retention also was maintained. And the animated videos, whiteboard animation, module quizzes, glossary, suggested reading helped participants to improve the acquisition and retention. Moving to the clinical judgment scores. In clinical judgment scores, similar way we looked into day-wise comparison, and it was found that experimental group had higher significant values as compared to the conventional one. Looking onto the between the groups assessment, this is also reflecting that both comparison and experimental group, when they compared, there was significant values. This suggests that online program was bringing changes. Therefore, F03 was rejected. Comparison of area-wise identification was also done. So in this, we can see conventional teaching as well as online teaching was there, but nursing responsibility was found to be better in online virtual learning program, because we gave them different case-based scenarios and they had to choose the different nursing actions related. This is further again, we looked into it and we found the significant changes. Overall comparison was also done in both the groups, and it was higher in virtual learning program, that is experimental group. Here also we looked into general linear regression model, and we found the significant values and retention was there of clinical judgment as well. So real case-based scenario helped participants to improve on their clinical judgment, and critical appraisal skills were improved, and similar results have been found in other studies as well. So
Ma'am, one submission, ma'am. Can you
Yeah.
come to conclusion, ma'am?
Yeah, just almost.
Please.
So
Yes, yes, ma'am.
so these are the clinical judgment correlation between judgment and retention of the scores. So this is a correlation matrix where we can see that these are showing correlation between the, if you increase the acquisition retention, you can increase the clinical judgment. So positive relationship was assessed. This is about the association of variables. So we did not find any variable to be reflecting on any of the data collected. So there was no association. Coming to the last part of it, that is acceptance. Acceptance was 86% said that it was very helpful. Rest 15% were neutral about. So this is about the conclusion based on the findings. Experimental and comparison group did not differ in the comparison when we did pre-test comparison. Virtual learning program was effective in enhancing the acquisition, and results we have shown that virtual learning program improved the both aspects, that retention as well as the clinical judgment, and there was positive correlation between acquisition, retention, and clinical judgment, and the program was highly acceptable and useful to the participants. So here I rest my presentation. Over to the audience.
Thank you, ma'am. Thank you.
Thank you so much.
Thank you, ma'am. Thank you for your wonderful study, ma'am. Now I would like to ask feedback from the resource persons. Amandeep, ma'am, anything you wanted to add? Amandeep, ma'am?
So it was very nice presentation and cover all the aspects. It's a very informative session. All things are covered, so no addition from my side.
Thank you, ma'am.
Khanna, ma'am, anything you want to add? Khanna, ma'am?
Ma'am, please unmute.
इधर आ चुके नहीं हो गया तो स्यापा सारा ढुल गया
Hello. Yes, it was a very good presentation. Nice topic covered. There was a clarity and well done. Well done. I really congratulate you that you have come forward and did a great job. It's continual education in nursing is very, very, very important. And upgrading and updating our students and our nursing community is very important. And I'm so proud that I am associated with such kind of knowledgeable person who I can learn from every day. They are very inspirational, motivational, and I know it's very difficult to take out such tasks and present in front of such a community who are legends in nursing. So I really congratulate you, madam. You've done a great job, and I'm looking forward to other presentation. Thank you so much for giving me this
Thank you, ma'am.
opportunity.
Thank you.
I feel
Thank you,
blessed.
ma'am.
Yeah.
Ma'am, Khanna ma'am, anything you want to add?
Ma'am, you are muted.
Madam, please unmute.
Ma'am, please unmute, ma'am. Khanna ma'am, please unmute.
Yeah, okay, now I keep on speaking and it is not
ma'am.
going anywhere.
He's muted,
I said
ma'am.
it was very extensive and very nicely presented. Was there any replica study?
No, ma'am,
Jyoti?
there was no
Okay.
replica study which I could
Oh,
find.
okay. Yeah,
Because
maybe you can push your students, one of the students, if they can take, or a group of them, if they can take that big, responsibility. But it was very eye-opener, I must say, whether you were feeling good or not, but you
Yes.
presented it, and thank you so much.
Thank you, ma'am.
Okay, to the next.
Yes, ma'am. Bimla ma'am, anything you wanted to?
Yes, I would like to say congratulations to ma'am, presenter ma'am. And it is a very, very valuable study for the nursing profession, and even the all aspects and areas of nursing, including the education practice as well as in the research area. And it is very applicable and important study for our nursing profession. And I think it may be conducted in the wide range and in the clinical areas. So really great to say thankful to Jyoti ma'am, and very, very congratulations. It's very wonderful presentation with covering with all aspects and steps of the research presentation and research studies. Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am. Thank you for your words.
Thank you, Jyoti.
Next, I would like to introduce our third research presenter, Dr. Smriti Mani ma'am. Madam is currently working as a Dean of Nursing at the New India University, West Bengal. And Madam earlier, Madam was a former principal of Government College of Nursing, Medical College, West Bengal. Madam has many years of professional experience in a variety of settings, and Madam has participated, presented, organized, conducted many workshops and conferences. Madam has been a resource person, member of many boards of journals, and seasoned publishers of many scientific articles in her own specialty. And Madam, about publication, Madam, in total 38 publications are there in various national and international journals. And Madam is editorial board member of Malaysia Journal of Nursing Research. And Madam is a PhD guide for INC, Amity University, Annamalai University. About professional membership, Madam is a life member of TNA and Vice President of West Bengal. And Madam is our NSS Hall of Member, 10-star President Circle member also. And life member of NRSI and member of IPH and life member of IANN. Ma'am, actually, I had so much things to say about you, ma'am, but due to some time restriction, so I could not, ma'am. Over to you, ma'am.
Thank you. Thank you very much. Can I share my screen?
Yes, please, ma'am. Just I'll exit, ma'am.
Okay, okay. You will.
Yes, ma'am. You can. Yes, ma'am.
Is it visible?
Yes, ma'am. It's
Yes.
visible.
Okay. Thank you very much for giving me the opportunity, madam. So really, I'm so happy to be here today. I was just listening to the last presenter. She has vividly presented, and really, Jyoti, you have done a lot of statistics also. So I'm so happy. My topic is really different because I am from OBG specialty. I want to tell that birth is really beautiful. 9 months, 7 days, one mom is carrying her baby. So this is really very personal event for all involved with that. So, but when I started my study, that time during just normal delivery is 90% for the mothers, there is no problem. But for the 10%, there is a problem, complications. For that reason, we want skilled individual and a team, of course. So when I started my study in the year 2007, and when I have seen that the 3.1 million babies died during their first month of life, and it is seen that the 2.7 million deaths, roughly 45% of all under 5 days occurred during the neonatal period. And in 2015, the current neonatal mortality rate was 44 per 1,000 live birth. Just think about that. The mother is carrying the baby, but she's unable to take her baby after 1 year. So this was really very tragic conditions, and causes we have seen that the infections, that is 36%, and preterm baby, that means the hypothermia also, there was the death, cause of death, and 28%, and birth asphyxia. These are the leading cause of death. So the investigator thought that why not to do something which the conditions are preventable. So let us do something which how can I prevent all those conditions and prevent the neonatal mortality rate. So I took that problem, that is the effect of planned audit process on nurses' performance. That means nurses' performance, nurses' knowledge and skill, according to the nursing practice standard on neonatal care in the neonatal areas of West Bengal. So my objective of the study was first I observed the baseline performance of the nurses on their performance, knowledge and practice in the neonatal care. I could not take all the areas. I have selected 3 areas, that is the resuscitation, hypothermia prevention, and the prevention of sepsis. So I prepared the practice standard statement for these 3 areas, and then developed the audit tool, and we compared the before and after the planned audit process. And another thing I took that is the teaching hospital and non-teaching hospital. Is there any difference between the teaching hospital and non-teaching hospital? That was also my objective. And of course, the relationship between knowledge and practice, and any association between the post-test knowledge on teaching hospital and non-teaching hospital among the nurses. So I want to tell that I know you all know that the practice standard. So here in my study, I took that this is the explicit statement where aim will be there, one standard statement will be there, title, and then expected outcome will be there, prerequisites will be there, then process will be clearly to be written down, and then audit tool. So audit tool means nurses' performance will be checked by using the checklist, and if they are not performing, then the action plan, what will be done. So it was a comprehensive method. We took that. So usually we call that the protocols are there. So what is the difference between the standard and the protocol? Standards are the guidelines. These are common, more abstract. You can have product that meet the standard, exceed the standard, or below the certain standard. But protocols are rules. For example, I can tell that in some hospital, the not to start the breastfeeding just after delivery. It may be their protocol, but it may not be the standard. So for that reason, it was taken that the standards in that neonatal area. So my assumption was that nurses will do it frankly, express their knowledge. They must have some knowledge as they are working there. And not only that, that knowledge of practices of staff nurses, whatever exactly they are doing, it will be depicted there only. And planned audit process will help us to identify the quality of the service. My study was delimited to West Bengal, to the hospitals where more than 500 deliveries are taking place, because we wanted to work on the neonatal care area. So for that reason, and not only that, level of knowledge, just administrating the structured knowledge questionnaire. There are so many ways whenever they are doing, but only that was taken. Level of practice was measured by the observation checklist, and selected areas were taken where the all those procedures are happening. So those areas we took. So these are the limitation, and conceptual framework was done by the quality assurance cycle, because I could not do the 3 phases, that is the describing phase, audit phase and taking action phase. Describing phase, of course, it was done quite in a proper manner, and training workshop was given, and the audit phase was done in a proper manner. But I identified what are the actions to be taken and informed. So taking action phase, I could not do it. So it is not under my study. So if I see the schematic diagram, that it was a pre-experimental design. First of all, we thought that the 2 groups will be taken, but it was huge work, so we could not. I could not take that the 2 groups. So it was only 1 group, pretest post-test design, and I took some randomized control. Randomization was done, and Madam Dr. Aparna Bhaduri was my guide. So teaching hospital and non-teaching hospital within the West Bengal. So lottery by lottery, 6 teaching hospital and 6 non-teaching hospital was identified. Population was staff nurses who were working in that area, and of course sampling technique was non-probability, because who were working in that area only, they were chosen. And in the labor room, because they are giving the newborn resuscitation, SNCU, postnatal ward, where these 3 procedures are going on, we took that staff nurses only. So in this way, 222 staff nurses were taken, and variables were demographic variable, independent variable were that is the planned audit process according to neonatal care standard. So standard was developed, and according to that, it was introduced to the staff nurses. After that, planned audit process was implemented. So dependent variable was nurses' performance in terms of knowledge and practice. So data collection tool was the structured knowledge questionnaire, and the that is the neonatal care area, that standard, that is the newborn resuscitation, neonatal hypothermia prevention, and neonatal infection prevention. And observation checklist was done on newborn resuscitation, hypothermia, and infection prevention also. So both the statistics, descriptive and inferential statistics, were used. So setting, I have told that the 5 teaching hospitals and 5 non-teaching hospitals were randomly selected. So I am coming directly to the analysis part. So in teaching and non-teaching hospital, we can see that the most of the staff nurses, they belong to 30 to 37 years old. So mostly they are young, I can say that. So that I cannot say that they are very old, they are not willing to accept the changes, but they were willing to accept the changes. So, but it was very tough, because very less number of staff nurses were there. So to collect, to train them, to orient them with the whole practice standard, and to expose them that how the audit will be done. Everything it took so much time. Not only that, their pre-practice and after the implementation of the audit process and neonatal standard, the post-practice, and all 3 areas practice, it was really difficult. And just quickly, I'm going to though really it was successfully I did it. And so knowledge score, we can see from that T table that it was really significant change was there regarding the pre-test and post-test knowledge score of staff nurses in the newborn resuscitation area. So significantly it enhanced. And if we see the hypothermia area also, of course, there was pre-test score was high than the pre-test score. And if we go to the neonatal infection area, that is also T-test was done, and it is so that the significantly it was enhanced their knowledge. So if we go to the practice area, we can see that the practice area also there was significant. There was significant.
એમ આખું આ બાકી નહીં રાખવાનું, બધું આખું આ કેમ આપણે કર્યું છે એવી રીતના આખું કરી દેવાનું.
Okay, so newborn resuscitation area also there was significant changes. And if we see the newborn hypothermia prevention, there was also in practice score, it was also significant. And in infection area also it was significant. So now we are coming that both the area we have seen that after the teaching means introduction to that practice standard and the audit process, really it worked well, and knowledge and practice both things went well. But I was really surprised to know that usually we know that the teaching hospital nurses, they know so many good things, and they are observing. But surprisingly, non-teaching and teaching hospitals, there are no significant difference, because staff nurses who are belonging to non-teaching hospital, how they are also practicing, and teaching hospital, they are also doing the same thing. Because only one thing, as you teach them, they will do for some time, because I will go later on for my action plan, then I will explain that. So there was no significant difference in knowledge score, no significant post-test also, teaching and non-teaching, there was no significant difference. So, and also, so I can say that the teaching, and as our idea, it's a myth only. The teaching hospital nurses, they know more than the non-teaching hospital. So it doesn't matter, teaching or non-teaching hospital. So next, other relationship between the knowledge and practice score. Of course, there was a positive relationship. We know it very well that in 3 areas, we have seen that the newborn resuscitation area, neonatal hypothermial area, and neonatal infection area. Both 3 areas, the knowledge and practice score was positively related. We know it very well. If knowledge increases, then the practice also increases. So another my objective was the association between the post-test knowledge score of neonatal care standard between the teaching and non-teaching hospital. Here also I have seen that at least in the post-test knowledge score, we thought that something will change, but there was no change, no significant association in 3 areas between the teaching and non-teaching hospital. So there was no association at all. So these are the findings from where I just came to know that yes, if we give the proper prerequisites, and if we have a standard, if we have a goal, and if we give them the proper steps, and we teach them properly, and if we give them the practice in their own area where they are working, then really it enhances the knowledge and the practice of the staff nurses. So the action plan was taken, because action plan means that why, if they are doing, it's okay. But if some staff nurses, they didn't do, then I go to them that why are you not doing? Is there anything that can improve the process? First, I told them that, ask them that are all the criteria specified in the checklist for audit of the standard being met? If they told yes, met, then it's okay. Then I came to that point that is there anything else you can add in that audit? Then if no, then no, nothing is required, then they will say, are everything all right in place? And if no, then specify what is missing in my standard. So and if is the process being followed? If is the process as written faulty? Why are you not following it? So is there any faulty? What are you thinking that any step process is also written in that standard now? Then I asked them that are you thinking that is there any fault process is there? So I wanted to identify why they are not doing. So again, I came to that what action is required to correct the process. Then I asked, why are you not doing? What action I can take? So if you tell me that, madam, articles are not there, I don't know, I am not interested, exactly everything. So exactly where is the problem? What is missing? Why the action is not done? So what to be done to rectify all those conditions? So individually, I told them, I have talked to them, I have filled up this observation checklist. And then if you think that the things are not there, but I don't have any time to do that, then I told that whom to tell. You tell me, nursing superintendent or medical superintendent, whom to tell to take the action, because we want that you will do everything as per process, as per standard. So after that, after taking all those information, then date of actions we have taken, and then responsible persons, we have asked them who are the responsible person. If we tell them, the action will be done. So and we have already informed hospital to hospital hospital. I went to nursing superintendent, conducted a meeting, and I told the nursing superintendent and superintendent that these are the areas where your nurses are not doing. So if I go to the next slide, you will come to know that the 86% told that yes, all criteria in the audit tool and the standard, everything is checklist for audit, everything of the standard are made. 86%. 14 told that no, we will not. What it didn't do also, then they told no, we will not be able to do. Then is there anything else which need to improve? They are they're telling 75% told no. Nothing need to be improved. 25% told that yes, need to be improved. But condition, staff, there are so many points they told that this is need to be improved. Then are there any other prerequisites that could be included to make the process easier? Then 83% told that no, nothing is required. But 17% told that yes, there are things. So all prerequisites are in place. I told that. Then they were telling 78% told that yes, everything, all prerequisites are there, all articles and everything, whatever is needed to give the, to do the work properly. So it was there. 22% told no. Then is the process being followed? 38% told yes, we are following, but 62% told no, we are very busy, we will not be able to follow all those steps. We I don't know, you are observing us, so we are following, but after that we don't know whether we will be able to follow this because this is all steps in a proper manner. So we are very busy and there are really shortage of staff nurses, so we will not be able to follow all those steps. So I asked them, what do you think? Is the process written by fault? By faulty technique is there? They are telling no. 55% or no, there is no fault. It should be done. And 45% told that yes, madam. So many things you have written properly, draw it, then all those things we will not be able to do because we are very busy persons. We will not be able to do in a proper manner in all those areas. So I told them that any action is needed to rectify the process. They told 67% told that yes, you can do that. So I told them that you didn't, why didn't you do this? They told that some reason that the staff nurses were very busy with paperwork also than the nursing care. They are telling, madam, we have to record so many things. How can you do all those 3 procedures only you are checking and less number of staff nurses? There are really shortage of nursing personnel in the working field. So the attitude of the all staff nurses toward the quality care as per standard, because I wanted to give the quality care, really it was not made. So I was telling madam, it's not possible always to maintain that standard to that level, and there was a lack of constant motivation for the better performance. So I have seen also that ward in charge, she was not always with the staff nurses, so she is sitting in the other room. So it was constant, yes, you are doing good job, oh, you are following all steps. So nobody was there to tell good job or it's okay, nobody was tell them to. So they are telling, madam, nobody is looking after also, so whatever we want, we have to finish the work, we are doing that. This part I thought that I will continue later on again and again, but the same thing, because there are really acute shortage of staff nurses. So I have informed, I conducted the meeting, I have informed nursing superintendent and of course hospital superintendent regarding the matter, if they can enhance the nursing personnel. And for the prerequisites, I all the articles I prepared only, I brought and I kept there, but I told them that you need also to keep all those articles and everything to make the procedure, to provide the quality care. So all those things I informed, and I have seen in the discussion, I want to tell that yes, my study findings also going to the supported by other study findings also. That is Michael and Lisa is supporting my study, and also M. Begum, they also conducted a competency-based teaching program. It is also this findings are also supporting my study. So in conclusion, I want to tell that on the basis of my study findings, the present conclusion can be drawn that really there was deficiency in knowledge and practice among staff nurses. Nowadays, in the neonatal care standard on newborn resuscitation, neonatal hypothermia prevention, and neonatal infection prevention areas before implementation of the neonatal care standard. So really it was effective in enhancing the knowledge and practice of the nurses in those areas. There was also positive relationship correlation I have seen between the knowledge and the practice code, but there is really no association between the teaching and non-teaching hospital. So these things, that is the quality. Whenever we are thinking about the quality care, we have to go to the practice standard. Then only we can think about the quality care. And at the same time, who will provide the care? Then we need some manpower also, and also equipment to provide all those cares in a proper manner. So a limitation of my study was that due to shortage of nurses in the neonatal care area, two teaching method. We thought that the one teaching will be given on the spot and another bringing them to a proper skill lab and doing that. But there was really shortage of nurses, so we could not follow that two teaching method. Only one teaching method, on the spot teaching method, was used. And the first proposal also, it was taken that again and again we will take the post test. My goodness, when I went to take the post test, and all those in one hospital, 27 nurses, so 3 procedures, one to one, it was by observation. So it was not possible to go again and again after some days time series. So I could not do that. And not only that, other sampling technique also, except that non-probability, it was not possible, because only who are working in that area, those staff nurses were under the study. So recommendation, this type of studies really can be done, and really it was effective. And I know that if we want to do the quality service, quality care, then we have to go for that. So these are the references. There are so many references, but I am just putting here few references. So thank you very much. This is my study, and thank you very much, ma'am, for giving me the opportunity. Yes, sir. Sir, over to you.
Thank you, ma'am. Yes, ma'am. Thank you. Thank you so much, ma'am. Thank you for wonderful research presentation, ma'am. Now, the feedback from the Bimla, ma'am. Ma'am, anything you wanted to add? Bimla, ma'am.
First invite Dinesh.
Yes, ma'am. Dinesh, sir, have you
Invite
joined,
Dinesh
sir?
first.
Hello.
Yeah,
Dinesh,
Yes,
sir?
sir. Yes, sir. I'm joining, sir.
Yes,
Good
sir.
morning,
Just a minute, sir.
everyone.
Just I
Yes,
introduce your
please. Hello. जी स्मृति मैम
Yes,
ma'am, very good morning, and very thankful to you. I am eminent personality, and as well as you are eminent speaker. But as my specialty in the pediatric nursing, I
Yes.
must say that with this knowledge and practice regarding hypothermia and that neonatal infection, the main thing is that should be and to be very important to observe and assess, that is the hypoglycemia, as nurses need to initiate the breastfeeding and
Yes,
along with the warm stain. I think, according to my specialty, I think there must be the term hypoglycemia, as it is the equal and important risk factor for the hypothermia as well as with the neonatal infection. So the at the time of that, you told in your study that 10% mothers with the cesarean section and postnatal complications, they are not able to feed their newborn, and that's the nurse's duty to care about the care for the newborn regarding hypothermia, hypoglycemia, and the infection prevention in the neonates. So I think it must be added with the hypoglycemia, because it is the very, very important factor that is fatal and for the that morbidity in the neonates. Hai na? So
yes, ma'am, I took that one. Thank you, ma'am. I took breastfeeding also, but due to time shortage, I could not do it. So I am not showing that objective. Yes, ma'am, you are right. Ma'am, you know,
yeah.
now that neonatal mortality rate is reduced to 22. Think, when I started, it was 44. So really, I'm so happy now that it is reduced. Thank you, ma'am.
Ma'am, because hypoglycemia is the prior cause for the hypothermia as well as sepsis in the neonates. So
Yes.
that is the nurses standard practice for the neonatal feeding as well as the NG feeding, spoon feeding, EBM, or and the other mode of feedings. So it should be with the standard care, because when we feed, particularly in the neonate and the preterm, there are so many complications with the NG feeding and as well. So it should be, I think, assessed and compared with the standards, because it must be standardized
Yes.
care in the neonate to prevent the further complications and neonatal mortality and morbidity. Thank you, ma'am. It's wonderful presentation, and you are a really nice and eminent personality as well as the eminent speaker in this.
Thank you, ma'am. Thank you, Binda
Yes.
ma'am.
Thank you.
Khanna ma'am,
Thank you
anything
for-
you wanted to add? Khanna ma'am, anything you wanted to add? Now, I would like to introduce our first presenter, Professor Dr. Dinesh Rai, sir.
Muthu sir,
Sir, yes,
Muthu sir, yes, sir, very
yes.
sorry to disturb you. And with permission of you all, madam, because actually vibrant students are waiting, because actually it's one Sunday and other days they are, means their classes will be there. Hello?
Yes, sir.
Sir, Dinesh has some kind of problem. He wanted only 5 minutes. So
Acha,
give us
okay,
5
then we
minutes,
will
please.
Okay,
Thank you.
okay. Continue. Okay, Muthu sir, continue.
Don't go through his
Yes, sir.
profile. Let him talk.
Yeah, I know I invite Dr. Dinesh sir to continue with this presentation. Dinesh sir,
Yes, sir. Hello. Yes, sir.
please go ahead, sir.
Yes, sir. My PPT you have all, or I will play.
Sir, if you have, you play. Otherwise, I'll play it, sir. Not a problem. If you wish me to have, I'll play it. Not a problem, sir. Then I'll add it. Not a problem.
Actually, you will play,
Sir,
play,
this
sir. You will,
visible, sir? Yeah, please go ahead, sir.
No, sir. I didn't see, sir.
Is it visible, sir?
No, sir. No, sir.
Just a minute, sir. Yes, I'll make it visible. Now, see, sir, is it visible now, sir?
Yes, sir. Visual, sir.
Please go ahead, sir.
Good morning, everyone. My name is Dr. Dinesh Rai. I will present my study. Study to assess the effectiveness of cardiac rehabilitation program on activity tolerance, elected physiological parameters, heart rate, electrocardiogram, ECG, and quality of life among hospitalized CABG surgery patient in Hospital of Madhya Pradesh. Next page. Introduction. Cardiovascular disease is the leading cause of global health, accounting for million deaths per year. Number of expected grow more than 23.6 million by 2030. One of the diseases that affect the blood vessels of heart is coronary artery disease. There are several medical managements available. If there are multiple blocks are in the vessels, surgical treatment is needed. One of the advanced surgical procedure is coronary artery bypass graft. After surgery, cardiac rehabilitation program helps the person to attain maximum physical and psychological health. Next page. My study aim was the aim of the study. Those who received cardiac rehabilitation program will experience more activity tolerance and improved physiological parameters like heart rate, ECG, and quality of the life. Next page. My objectives are in the study. First off, to find out the pre-test and post-test activity tolerance, selected physiological parameters, heart rate, ECG, and the quality of life patients with CABG surgery in experimental and control group. Second objectives to find out effectiveness of cardiac rehabilitation program in terms of activity tolerance, selected physiological parameters, heart rate, ECG, and the quality of life of patient with CABG surgery. To find out third objectives to find out the relationship between activity tolerance of the patient with CABG surgery who received cardiac rehabilitation program and their quality of life. And fourth objectives to find out the relationship between physiological parameters like heart rate and ECG of the patient with CABG surgery who received cardiac rehabilitation program and their quality of life. Next. And the last impact of my study, cardiac rehabilitation program are offered as organized session with monitored physical activity. This is adapted to the capacities of those who attend. It has provided a way to know further regarding the subject's state. The means to specify the make a better one comeback. Additional knowledge provided by nurse are about good dietary pattern and reducing cholesterol. The significance of physical activity to difference between heart attack and angina and about medication. There is a good evidence that people who attend cardiac rehabilitation programs are better and keep doing well. It is an opportunity for them to learn more about their own condition and recovery. It is a good introduction to enjoyable exercise, and most people reported that they feel more confidence. It helps to person have positive life changes and empowering the process of getting information and the skills that can lead to change human behaviors are needed to their betterment of health. Next page. Thank you, everyone. Sir, my study was.
Thank you, sir. Thank you for the wonderful presentation, sir. Bimla ma'am, anything you wanted to add?
Okay, we will go to the induction part.
Thank you, sir, Dinesh sir. You are really presented in the nice way. And it's very, very important topic in the nursing professional. The close observation and the basic care is very, very important in the cardiac patients. So it's a wonderful presentation, and I thank you, Sir Dinesh sir, and congratulations.
Thank you, ma'am.
Go to the induction part.
Yes, ma'am. Now, the induction part will takes place. For induction of all the new members in Nursing Scholar Society, first reading of list of names by the patron ma'am from January 1st to till date. There are three categories of the membership: student category and regular general members and president circle membership. The student circle membership around 224. The list will be read by the Mr. Sandeep Kumar sir, Vice President of Fancy Chapter of Tripura State, a military person known as Jugaru Professor G. Over to you, sir.
Thank you, sir. You give a great opportunity to me to read out 3-star members. The following name. You have hear my voice, sir?
Yes, please, sir.
Okay. The 3-star members. This first name is Sepali Shankar Nimla, Dhawani Gohil, Sitar Halpati, MS Sheikh, Patel Jeevan B, Jeba Khatun Patel, Diya Ben D Raut, Barucha D Rajesh, Mamta R Gamit, Javi Deshmukh, Yashvi Y Chaudhary, Krishna G Tandon, Gamti Parpati D, Patel Pragati V, Patel Sonal D, Surti Havati N, Kataria Prachi R, Disha V Chauhan, Nirali K Desai, Bariya Jyoti, Patel Mohini Ben, Patel Riddhi R, Chaudhary Nishit K, Jagatpal Vaishali S, Patil Mahima D, Gamit Yes J, Nidhi Trivedi, Avni Ben Chauhan, Patel Mansi M, Patel Mansi RB, Patel Anjali M, Asmita Johan, Joja JM, Milan Agrawat, Karmur Jagruti, Patel Bhumi B, Chauhan Shweta G, Bhoya VM, Dhawani Vishwa P, Chaudhary BR, Borsa Puja Ben, Chaudhary AG, Chaudhary NN, Chaudhary PV, Chaudhary RJ, Chaudhary SJ, Chaudhary JH, Chaudhary VA, Deshmukh RK, Damor PN, Bhoya DP, Chaudhary VH, सोलंकी DA, Gamit SD, Konkani SJ, Jogi JH, Gavi AS, Gamit SS, Gamit PR, Gamit MB, Gamit KC, Nayak KV, Makwana KB, More SS, Master IUCP, Konkani SJ, Jogi JH, Gamit MD, Patel AP, Nayak SD, Patel SDD, Patel DD, Patel PG, Patel KK, Patel MH, Thakur PM, Waswa PD, Waswa BP, Veragi GD, Rathod RH, Patel AA, Patel MV, Patel PC, Patel SD, Patel SS, Patel KD, Patel KP, Patel HN, Patel SP, Prajapati KK, Chaitanya MK, Gamit NR, Walvi SS, Chaudhary AV, Patel DP, Gamit AD, Walvi RR, Makwan SR, Ahid JH, Bricha DH, Patel DS, Patel DM, Patel EN, Patel JA, Yadav Anam, Pawar CS.
Excuse me, Sandeep. I have to interrupt
ma'am.
you. I have to interrupt you. Please stop it here. Let us finish with Alkaji. She is waiting with the students there. So let us
Okay,
go
ma'am.
to Binu, sir. So I'm sorry, I'm not reading mine also because they just sent the message. So let us go to that one.
Yes,
Next.
ma'am.
Thank you, Sandeep. I'm not reading mine too. So just go to him.
Okay, welcome, ma'am. No problem.
Yeah, just stay with us. Oath ceremony.
Yes, ma'am. Just I'll share the screen, ma'am.
Invite Binu, sir. And then
Yes, ma'am. I'll
connect
invite.
with
Just a
Alka.
minute. Yes, ma'am. Just a minute, ma'am.
Yeah, connect with Alka. Hey, nursing college. Yay.
Now I would like to call Dr. Binu sir to conduct the oath to begin with the national president. Over to you, sir.
Yes, next PPT.
It's visible, sir.
Yeah. I, Binu Jo, solemnly pledge my allegations to the society that I will be abiding the rules and regulations of this honorable society. I will discharge my duties and bear the responsibilities as an office bearer. I will carry on my responsibilities as a life member. I will be a responsible member and not give any statements to media or any groups which will reflect negatively on the society. I will function as a part of the society and not solo to promote my agenda or business. In front of Almighty and general body to uphold the nursing professional standards and project the honorable image of my profession. Please, all the students, please, all the members, repeat, I do.
I do. I do.
I do.
I do.
I do.
I do. I do.
Thank you,
Wonderful.
sir.
Wonderful.
Ma'am, can we invite Alka, ma'am? Anything she wanted to say?
Yes, please. Let
Alka,
him
ma'am,
come and say
anything you want?
something.
Alka, ma'am.
Yes, sir.
Good
Ma'am, anything you
trial.
want to say? Yes, please go ahead, ma'am.
It's my pleasure that our student first time have taken oath. Thank you to Dr. Khanna ma'am, Dr. Binu Jo.
Aira principal, ma'am. Aira mara student.
It's a pride to present. in front of her, and we have taken both along with my student. Thank you so much.
Wonderful.
Thank you, ma'am.
Congratulations to all of you.
Thank you very much, ma'am.
It was a wonderful trial. We did it first time.
Yes, ma'am. Ma'am, over to you, ma'am. Khanna, ma'am.
Okay, we go to the vote of thanks. Next slide, please.
Yes, ma'am.
Well, it is
Just
a
a minute,
time now that we are nearing the end of the session. It's time to thank our dignitaries and presenters. Our sincere thanks to Professor Dr. Amandeep Bajwaji for honoring us with her gracious presence and interacting with the presenters. Thanks to our guest of honor, Professor Dr. Bimla Devi Kaushalji, for playing diligently also the resource person part by contributing her valuable feedback. Our thanks to our green guest of honor, Professor Dr. Bimla ji. She couldn't be here because she is running fever, but best wishes to her. My personal sincere thanks to Professor Dr. Muttu, who has played such a MC and did very good with the PPT preparedness. Our thanks to our national president, Professor Dr. Binu Jo, for providing uninterrupted Zoom lines and this powerful message. And this one, inducting all the members from January to April. Last but not least, our thanks to all the presenters and lovely audience and their valuable time for their hard work, researches for mutual benefit. Now we end here the formal recording